لك لبيك لبيك اللهم لبيك لبيك لا شريك لك لبيك إن الحمد والنعمة لك والملك لا شريك لك لبيك لبيك اللهم لبيك لبيك لا شريك لك لبيك إن الحمد والنعمة لك.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you everyone for joining us this afternoon and welcome all to the Health at Hajj webinar. Alhamdulillah, we can see that many of you have now actually booked for Hajj and you're ready for Hajj, and may Allah make it easy for you. My name is Rashid. I'm one of the organizers here at CBH UK, and this evening we're actually honored to have a very experienced Hajj guide and a group medical advisor, Dr. Imran Zia, joining us. If he can switch his camera on and we can welcome him in. Assalamu alaikum. Dr. Imran, how are you? You're on mute.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, I'm well, thank you. Thank you for inviting me to come and do this presentation.
So without further ado, we've got plenty of you logged in, so that's great. We'll make a start. The slides will be available post-event, so we'll share that with you in due course. If there are any questions, do send them over. We'll answer them at the end of the webinar. Whilst Dr. Imran goes through them, we'll be moderating them as well, so that we can have a quick rapid fire question and answer at the end, inshallah, and get you geared up. So over to you, Dr. Imran.
Okay, Jazakallah khair. I'm just going to share my screen, and inshallah, I hope everyone can see me. Let's just move on. So just to introduce myself, my name is Dr. Imran Zia. I've been fortunate enough to go to Hajj on a number of occasions. During those number of years, which spans probably 15 or 16, I've gone as a Hajj group doctor. I've also gone as a Hajj guide. And the important thing for me to share with you is a lot of what I'm going to present is based upon practical experience and my own personal exposure. And I have dealt with illnesses, I've dealt with people that have had strokes, I've dealt with people that have had heart attacks, I've dealt with people that have had miscarriages, those people that have had to have operations in Saudi Arabia, repatriations from Saudi Arabia. I've had to deal with intensive care facilities and liaison work there at all. I've also dealt with mental health issues and people actually returning from Hajj because they could not cope with the stress of Hajj, which subhanAllah was one of the most difficult things that I've ever had to be involved in. So I have a huge amount of experience in this and I'm always learning. I've divided this talk up into preparations before Hajj, which I'm going to go through really quickly. And the reason for that is much of what I'm going to present in the first 5 or 6 slides, you will have got from elsewhere. But I'm really going to concentrate and spend a bit of time talking about the practical issues that you are likely to face in Hajj and the things that, in my humble opinion, cause people a huge amount of stress. And I'm a firm believer in preparation, and prevention is better than cure. So if we can prevent all of these things, it's always going to be better. So with that said, the first couple of things are very straightforward. I won't go into much detail. You should all know this. COVID vaccinations mandated. You need 2 doses. This is common knowledge. ACWI, common knowledge. You need to have this, but there's 2 different variations. If you have even the temptation to just produce the certificate, I would say please don't do that. Actually do get the vaccine itself. There's another few vaccines which are desirable, not at all essential: seasonal flu, which we haven't yet had released yet, pneumococcal, Hep A, Hep B, tetanus. Just to mention, people have asked me in the past whether or not we need rabies. Unless you plan on going into the mountains, they are stray dogs. I have yet to find, ever see a dog in the haram, so I don't think rabies is necessary. And we're not from a country where yellow fever is required. So I'm going to move on to really the crux of this. Many people attend Hajj, and in the number of years I've been going, I very, 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 very rarely ever said, I don't think you have the physical ability or the conditions to go Hajj. I believe that people can go Hajj, but they need to take plenty of precautions. So a couple of tips, first of all. Many people have pre-existing medical conditions. That is not a reason for not to go Hajj. Asthma, diabetes, heart failure, cancer, sprains, back problems, recovering from operations, you name it. I don't think that is a reason not to go Hajj. But if you have a medical condition, please take a letter from your GP explaining what your medical condition is. And more importantly, give that letter to your companions. Because if you get ill, you may not be able to deliver that information. We've had patients that have turned up that have had kidney transplants, that have gone into severe forms of sepsis, but they've not been able to tell us which hospital manages them, what's normal for them, so on and so forth. So it's really important, if you have a medical condition, please take a letter from your GP highlighting that medical condition, take plenty of medication, make sure you take that with you in your hand luggage, because with 2 to 3 million suitcases or even more suitcases in the airport, it's not unknown for luggage to get lost. Take a repeat prescription with you or have the generic names. Try and keep your medication in your hand luggage. Now, a really important tip, I'll intersperse this talk with lots of golden tips. Any serious medical condition, please, please, please take the name of your consultant, take the name of the hospital, a contact number for them, and your hospital number. For example, I have had patients that have had kidney transplant and we know that their kidneys are not working properly, but we don't know what's normal for them. But they did have with them a letter, and I can contact a hospital or someone be able to contact the hospital and say, we know this patient's got a condition, so on and so forth. You tell us what the baseline is. So if you don't carry that information with you, you're going to run yourself into difficulties. Next one, this is relatively straightforward. Try and deal with all dental issues. You can get dentists in Saudi Arabia, but they do cost a lot of money. Spectacles, take a spare pair. Avoid contact lenses if at all you can. It's better to just wear normal spectacles. Wheelchairs, walking sticks. If you think about, do you need them? Just take them. It's easy. If not, you can buy them in Saudi Arabia. Folding chairs are easily bought, not a problem. Umbrellas, very, very, very useful, especially they'll help just take away the heat and deflect the heat. Light colors are best, and use unscented sun cream. Relatively straightforward. So I'll move on from there. Again, relatively straightforward. Please make sure that you start doing plenty of walking. Make sure you really count your steps in if you can. I'm not going to prescribe to you how many steps you should do. Everyone should know what they should and shouldn't be able to do, but it's a good time to start practicing, especially now you've got a couple of weeks before Hajj. Try and get as much walking done as possible. Don't overdo it. Don't injure yourself, but try and pace yourself. If you're going to buy new footwear, please, please, please make sure you wear in that footwear. There's nothing worse than buying a new pair of sandals, taking it to Saudi Arabia. Within 24 hours, you're riddled with blisters. This is not the time for you to be wearing in your sandals. Wear your sandals in right now. Start wearing them in and around the house, outside, so on and so forth. If you're diabetic, I would try and avoid the ones which are like the Pakistani chappals, which go between the web spaces, because they can lead to abrasions and nasty infections. And make sure if you're diabetic, you do see your podiatrist before you go. Now, again, early preparations. A couple of things, please, please, please bear in mind. Controlled drugs, Saudi Arabia, it's completely banned for you to take any form of codeine. The maximum strength of codeine you can take is something like sulfidine, but you will not be allowed to take in any form of morphine. I've had patients that have come to me that said they are taking methadone, which is a substitute for heroin. And what do? I've asked them to contact me separately outside the scope of this talk. If you need morphine, because for whatever reason, maybe you have cancer or you need to have drugs which are strong like this, please see your GP, get a letter, and maybe contact me via cbhuk, and I can give you some advice. I will always say take a letter from your GP if you need to take any morphine type of painkillers. Another one, many patients are diabetic, And people forget that if they take insulin, insulin has to be kept in the fridge. And you may be at times without a fridge at your disposal. That may be the case in Mina, that may be the case in Muzdalifah, that may be the case in Arafat, that may be the case where you may be stuck on long journeys. The longest coach journey I've been involved in has hit 22 hours. I don't think any of you will be taking coach journey that will be 22 hours, but it has happened in the past. But that was about 15 or 16 years ago. So hopefully, inshallah, it will never happen again. But even so, how are you going to transport your insulin? Insulin has to be kept in a cool environment. This is a cooling wallet that you can buy from many pharmacies. You can buy it on the internet, on eBay. It's called Fryo. That's the trade brand. It's about 14 or 15 pounds. I would encourage those of you that carry insulin with you to take that with you. It's a really useful, very easy to use device. So please consider purchasing this. If you are diabetic, then please always keep a sugary snack with you. The reason I say this, there was one year where the Haram was so congested. Again, hopefully it won't happen. The Haram was so congested, they actually locked all the doors for the safety of all the Hujjaj in the Haram. So this wasn't people able to get in, people couldn't actually get out. That was a really, really, really stressful year. So, and if you are diabetic and you feel your sugar is going to go low, please make sure you have a sugary snack with you at all times. And I'll also say, please make sure that you factor that in with your aeroplane journeys, because some of you may be flying where your airplanes will arrive in the middle of the night and there may or may not be any food facilities available. Now, this one, I'm going to spend a bit of time on saying this. Probably every other year, I have dealt with patients with psychiatric issues. I make it very clear indeed, having a psychiatry issue does not mean you cannot go on Hajj, far from it. Having a psychiatric issue, there's nothing wrong with that. It's like any other illness. It does not stop you from going on Hajj, nor should it do so. But Hajj is not like Umrah. Hajj is not like Umrah. And if you get yourself into difficulty with psychiatry services in Saudi Arabia, unfortunately, although psychiatric facilities are available in Saudi Arabia, they're not easily accessible. And in my experience, unfortunately, you are often told to make lots of dua. People tell you to go and have ruqya done. People tell you to go and have hijama done, and so on and so forth. It's not taken as seriously as it is in the UK, although it is improving. Many of the drugs that psychiatry patients take are not freely available. They're really controlled, and you will not be able to get them without a psychiatrist. So golden tip here, number one, if you have a psychiatric history, please, please, please do not stop taking your medication. These medications often take a long time to work, and if you stop them abruptly, then you're going to not just cause yourself issues, not just your family issues, but it will affect the group that you're with. If you do get yourself into difficulty, unfortunately, the options that the hospitals will give you many of the times will to do one of the three above, or they'll end up giving you sedatives, which is not desirable, but that is how they often will treat you. So I would think when it comes to psychiatry problems, please, please, please make sure that you do not stop taking your medication, and make sure you, as best you can, let your colleagues know or your companions know what your issues are, and try not to overdo it. A couple of things I've mentioned is, again, coming back onto it, is drug names. We think of drug names which we're used to in the UK, but in the Saudi Arabia, Middle East and other parts of the world, they will use different drug names. Antibiotics, normally in the UK, we prescribe 3 times a day. In Saudi Arabia, they're often at higher dose, prescribed twice a day. In the UK, we use different units for measuring glucose levels, sugar levels, and in Saudi Arabia, they use different levels. There's a conversion factor of 18. So Saudi doctors may not necessarily be able to understand your drugs, your medication, and especially when it comes to diabetes, your units. So please bear that in mind. You can get simple calculators that you can put on your phone. So just, pay attention to this matter. Moving on to Makkah itself, I'll talk a bit about the medical facilities. Most of you should be aware of this. This picture is of the Abraj, which is the tallest clock tower in the world. There are a number of healthcare clinics dotted around the Haram, but on the left-hand side, there is a set of toilets at the base of this complex. On behind that complex, behind where the arrow is, the green arrow is, there is something called the Ajad Emergency Hospital. Now, I will emphasize to you that this Ajad Emergency Hospital is more akin to an urgent treatment center. It does not always have X-ray facilities. It has doctors, it has nurses, it can give you antibiotics, it can give you fluids, rehydration, treat asthma, but it may not necessarily be able to give you or provide X-ray facilities. That particular center does not have any advanced imaging such as CT scan or anything like that at all. But that is where you are likely to be taken if you become ill in the haram. So in the haram itself, opposite this complex, the doors start being labeled in an anti-clockwise fashion from door number 1. I think the door numbers now reach up to about 100 or 120. Door number 5 is where the main clinic is in the haram. So if anybody becomes ill in the haram, if you happen to be injured whilst doing tawaf, you are likely to be taken to the clinic, which is based on the middle floor in the haram, which is outside door number 5. And should they then need to take you to any clinic, they will probably move you to this clinic that I've just mentioned, which is outside the haram on the base of the Abraj complex on the left-hand side. Now, in the Abraj itself, this complex, there is a private clinic, but just to let you be aware, a blood test, for example, for sugar, can cost you anything upwards of £20. For those of you that are on medication that thins the blood, and you may need to check your blood levels, that blood test can cost up to £70. So it is not by any means cheap, but it is there available, and they do have ultrasound X-ray facilities, but that is a private setup. This is a bit more of a close-up as to where the hospital is, the small clinic, the Ajad clinic. The green arrow, as you can see, is pointing towards the location. And as you see, it is a very, very small sign here that says Mini Market Ajad Hospital Emergency. And the name for hospital is Mustashfa in Arabic. So you need to go down this little corridor here, and it's on the left-hand side. So that's the location in Makkah. Another thing about pharmacies is, again, for those of you that haven't been to Saudi Arabia in the last few years, about 4 years ago, they completely changed the way they allow pharmacies to work in the Kingdom of Saudi Arabia. Prescriptions are now absolutely necessary. They're not unnecessary. You cannot buy antibiotics if you want to go in. If you go to a pharmacy and there is no doctor available, there's no prescription, you will more than likely be asked to have a remote consultation with the pharmacist, who will then connect you to a doctor, and the doctor will then issue a prescription to the pharmacy, who will then dispense medication for which they'll charge you for. But please don't be under any assumption you can walk in and buy any antibiotics. That is not likely to happen. They will heavily fine any pharmacist that is caught breaking the rules. Another few things, there's some simple medications, well, simple in the sense that we see a lot of them in the UK. Flucloxacillin is a very common antibiotic, not available in Saudi Arabia. Chloramphenicol eye drops, these are not available in Saudi Arabia. Piriton, which we find in the likes of Poundland and so on and so forth, not available in Saudi Arabia. That will use an alternative. For those of you that have got heart problems and use a GTN spray, that's a spray that you will put under your tongue, especially if you get heart pain. That spray is not available in Saudi Arabia. Again, to mention, if you're asthmatic, sorry, I apologize, I didn't put this on the slide, but if you're asthmatic and you have a course of steroids in case you get a flare-up, you cannot buy steroids in Saudi Arabia, so you will have to take them with you if you need them, or you need to get them from the hospital. So those of you that require prednisolone, please take it with you with a GP letter, but you won't be able to buy it. I've already mentioned opiate-based drugs, you can't get them. And another one, which is a surprise to many people, you cannot buy Imodium. Imodium, which is used if you have diarrhea, you cannot buy Imodium in Saudi Arabia. It was banned about 5 years ago. So if you do have problems with loose motions, take Imodium with you. But I will counsel caution by using this freely, especially if you are passing blood in your motions. That's one of the indications, or you have severe abdominal pain, to seek medical help. Please don't go taking too much Imodium. So a golden tip there, if you need certain medications, just take it with you. If you need it, take it. Take it with you. Do not rely on it being available in Saudi Arabia. Coming back to hospitals, I've already mentioned the hospitals in and around Makkah. However, in Medina, there is a hospital called Masjid Ansar. It's about 2 kilometers away. I can only say good about Masjid Ansar. They have English-speaking doctors and nurses. Because it's about 2 kilometers away, it's not normally overly congested. It's a mixed hospital. It sees both men and women. Good facilities, CT scanning. They have an intensive care unit, and they offer, what I think is UK standard services. In Makkah, I would encourage you, if anybody really needs to go to a hospital and they're unwell, to consider taking a taxi to the Al Noor Hospital. The Al Noor Hospital is located in the periphery of Makkah. It's about 20 minutes car journey away, probably about 5 kilometers away. It's an ex-military hospital, but it's run to a very high standard. It has neurosurgery, it has cardiothoracic surgery, cardiac surgery, plastic surgery. Again, it has both services for men and women. Nearly all the doctors there speak English, and I don't think you're going to have a problem. There are hospitals that are located in Mina, Arafah, and Muzdalifah for the days of Hajj. These hospitals are really congested, really congested, but they do exist. So a couple of golden tips. If you need to go to hospital, number one, please take a form of ID with you. Treatment for people that are there for Hajj is free, or for Umrah is free, but you do need a form of ID, so please take it with you. I would encourage you all to speak English. I think if you attempt to speak Arabic, unless you're a fluent speaker, or you speak Urdu or Punjabi, you'll run yourself into difficulty. If you speak English, you will more than likely be directed to somebody that can speak English, and then you can get your point across. It's worthwhile taking an Arabic speaker with you to sort out the logistics and the problems with the paperwork. But before you go into the hospital, just spend a couple of minutes and ask yourself, why do you want to be there? What is it you want from the hospital? What is it that you really want them to do? If you say to them you're unwell, you're not going to get very much. So do give itself some thought. And if you have a doctor that's available in your group or your package or somebody that you're with, just formulate your mind what exactly is that you want them to do. Because if you can get that point across, in my opinion, you're going to get what you want. So if, for example, you feel that you're extremely short of breath, it's catching your breath, and you have sharp, what we call pleuritic chest pain, and you have a swollen leg, what you're trying to say to them, please can you exclude that I haven't got a clot on the lung. You've made their work so much easier because you've told them what you need to do. You will find that the nurses all speak English in the whole, and the doctors, and if you can get across that point to them, you'll make life so much easier. Couple of more things. Hajj cough. There'll be many people from all over the world, people from about 150 different countries, dry, dusty environment, viral spread, viral infections are there, upper respiratory tract infections are very common. Masks, I think this rule has now been changed, but that's why I put an asterisk is there. Up until a couple of months ago, it was still mandated to wear a mask in the haram. I'm not sure what the official line is, but when you're there, inshallah, you'll be able to find out and follow the local guidance. A couple of things about Hajj cough. We call it the Hajj cough because many people get it. It's not the same as the common cold. In the UK, we often say that we have a flu, but what we actually have is the common cold, which means that it's a bit gradual in onset. We don't really get a lot of temperatures and chills. We have a mild headache, a bit of a sore throat, a bit of a dry cough. You feel a bit weak. But in Hajj, this is more akin to what COVID was like. You get sudden onset, you get lots of chills, you get lots of headaches, you get a sore throat, which you really can't get rid of. It's really like a harsh sore throat. It's like a scratchy sensation. It's very dry cough. You really don't bring up any phlegm. Muscle aches are everywhere. And the weakness and fatigue can last up to 2 to 3 weeks. That's quite common. Prevention is better than cure. So I would say that if you're with somebody or in a group or in an environment where people are coughing, rather than telling them to stop coughing and go face to face, just move elsewhere. Use a face mask if you can. Make sure you use proper hand hygiene, look away and go find somewhere else. And prevention is better than cure. Wash, and try and stay away. I do think this is going to be a bit of a problem this year because of the congestion. bear in mind that we can treat this, but we can't cure this. This happens every single year. I always warn everyone, expect to feel unwell. Early interventions is very helpful. The things that we would advise people to do, and it's very simple, take plenty of rest, paracetamol, salt water gargles, lozenges. Antibiotics are neither here nor there. If we don't give you antibiotics, you get worse, you'll blame the doctor. If we give you antibiotics and you don't get better, you'll still blame the doctor. That's because often these are viruses and antibiotics don't help. There is an antiviral called Tamiflu, but you need to start it within 24 hours. And a few years ago, it was regulated because of SARS, and I don't think it's freely available. But it will reduce the symptoms by about 24 hours. So I'm not sure how beneficial it is, but just to let you know, this is, the crux of this is plenty of rest, paracetamol, salt water gargles, lozenges, antibiotic. If it gets worse, then do seek medical help. Now, that was a quick run through of the kind of prevention bits and bobs. I'm now going to go really onto the nub of this. Prior to 2015, in my experience, these were the common things that we were faced with during Hajj. We had pharyngitis, sore throat, menstrual issues, blisters, cracked heels, groin soreness, diarrhea, constipation, muscle cramps, and then dehydration. We should see a bit of dehydration, kidney stones we saw a reasonable amount, and lower respiratory tract infections. But then about 4 or 5 years ago, things really changed. The first two were pretty much the same. Pharyngitis was always there, menstrual issues, but dehydration really, really, really became a big problem. And I'm going to talk a bit about the top 3 or 4 in a lot more detail, because these will really cause a huge amount of problems. And dehydration, unfortunately, has led to a number of people being hospitalized in Saudi Arabia. So moving now on to actually Hajj itself, this is typically what ends up happening. 2 to 3 days before you're about to go Mina. Mina is on the 8th of Dhul Hijjah, it's the start of Hajj. And this is a picture on the left of what Mina is like. It's a tented area. And these are the facilities in Mina itself, which is mattresses on the floor, people sleeping in close proximity. You have some sort of ventilation, but it's not by any means AC. So 2 to 3 days before Mina starts, every single year, there's never been a year without exception where this has not happened. Women's issues are extremely, extremely, extremely common. I used to travel, I still do, inshallah, I'll be going this year, hopefully, inshallah, make the dua that I do. A group of 500 Hujjaj would go with Al-Hadaya or thereabouts, and half of the Hujjaj would be female. Of those half, 250, about 200 will be of childbearing age. Of those 200 of childbearing age, a quarter would probably be affected by cycle issues. That would be about 50. And of those, another, a large percentage would be affected with this. So this is typically what we see every year, is that you have sensibly taken advice, you've been asked to take some medication, and you've done it as prescribed, but it fails. It does fail. So normally the sister will take advice from another sister, and the sister will say, well, this tablet has worked for me. It may be different from the one that you've taken, so you take that tablet. So you've now had a second opinion. Then what will happen, you'll take advice from often what is a female GP, and they'll add in another tablet that still fails. Then this is really a couple of days before Hajj. There's lots of tears, lots of anxiety. And I've often shared my room with a mufti, with an alim, and he will get a phone call and he'll hand a phone call to me, and I'll give some medical advice and I hand it back to him. And so this happens. So a couple of golden, I'll come on to a couple of golden tips with this at all. Please, 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 I would advise you to see your GP. And you'll be given, there's a huge variety in the number of tablets that you'll be given. Some of these tablets will be like the normal pill, which you will just take, and they'll ask you to take it back to back with no break. Another type of tablet is one that you'll be asked to take 3 times a day, and another tablet you'll be asked to take is something that you take once a day. And I'll talk about the issues with all of these in a little while. Miscarriages are unfortunately very common. We see a miscarriage once every 2 years. And one of the things about miscarriages is that there is a bit of a trade-off here as to whether or not you use private hospitals or state hospitals, which hospitals you go to, what you really want, how do you get an ultrasound, so on and so forth. What I would say is, if you think that you may be affected by miscarriage, please seek medical advice sooner rather than later. Do not leave it to the last minute. It does cause a huge amount of problems. So my golden tips for this, again, is many ladies will go and see their GP, but be very clear to your GP that what you're asked is for the menstrual cycle to cease. Not asking for a reduction in the menstrual cycle, you actually want the menstrual cycle to stop. And the reason I say that is some of you may be prescribed a tablet which you take once a day, not the pill, but something you prescribe once a day. These tablets are often, they are contraceptives, the ones that are once a day, but they are progesterone, and they do have a failure rate. So some women will still have normal cycles, some women will have some bleeding, and some women will have no bleeding. That's not the preferred type of medication that you wish to take. The other one will be the pill. That's fair enough, that works very well, and do take that one. But the third one, which you're often prescribed, is one that you need to take 3 times a day. And I know that people will have different opinions of this, and I humbly respect all the opinions of, and I would imagine there's a number of GPs in this audience, and I respect your expertise in all of this, but my own experience on this is that I would ask ladies to start the tablets not just 3 days before their anticipated cycle, but 5 days before their anticipated cycle. It's very common in Hajj for cycles to start earlier than would normally be the case. That's number one. Number two, you're often asked to take the tablets 3 times a day, but no one tells you what 3 times a day actually means. These tablets work in a very, very, very short time frame. They have what we call a short half-life. Therefore, they have to be divided into 3 times a day. And I would ask you to set your alarm clock at 5 o'clock, 1 o'clock, or 9 o'clock, exactly 8 hours apart, or consider doing 6 o'clock, 2 o'clock, or 10 o'clock. Make sure you take your tablets exactly 8 hours apart. Please don't take them at, say 5 o'clock, 1 o'clock, and then 4 o'clock in the afternoon. That will mean that they will fail, and then you'll get yourself into difficulty. I would also encourage you, please don't get yourself involved in mixing and matching advice from different people. It's better that you stick with one person who has a level of expertise over this, who can guide you as to what you need to do. There are other strategies that you can use in an emergency, but it's better to seek that advice sooner rather than later. So golden tips, please see your GP sooner rather than later. Start your medication well in time, and set your alarm clock in Saudi Arabia 8 hours apart if you're going to take the tablet, which is 8 hours, 3 times a day. So that's a couple of days before Hajj is about to start. Now, Hajj is, that was on the 8th of Dhul Hijjah, where you'll be in Mina. On the 9th of Dhul Hijjah, the top left, that is Arafah. Not everyone will make it to Jabal Rahmah, but Arafah is a 4x4 kilometer area. You'll be praying in Arafah, and it'll be extremely hot. Some of you may be in areas where there is no AC, or temperatures will be really high, or the AC may fail. You'll be standing in the midday heat, and it's extremely congested, crowded, and very, very, very difficult. That night after Maghrib, and only after Maghrib, you'll be spending the time in Muzdalifah. This is the next picture with the arrow is Muzdalifah, where you'll be spending the night on the floor. There may be cars, there may be trucks, there may be people from lots of different nations, and people begin to get overtly worried about the state of affairs in Muzdalifah. I'm going to dispel your fears. The toilet facilities in Muzdalifah are absolutely fine. The queues are not that bad, and I really think they've done an amazing job with the Saudis. The picture on the right is people lining up in Fajr to try and make wudu. The lines are not that bad. They're only 4 or 5 people long, so not a problem. However, your journey may involve using the train. The train journey itself, again, is only 15 or 20 minutes, because you'll be going from Arafah, and you'll be making your way after Muzdalifah, from Muzdalifah to stoning the Jamarat. But that there is the queue waiting for the train. And that queue, as you can see, you may be in that queue for anything up to 3 hours, 4 hours, or even longer. So that's where a lot of problems begin to happen. And then if you look on the left, the train wonderfully AC'd, but it's extremely congested. So next thing that ends up happening is that people have absolute fear of the heat. They don't respect the heat, and heat exhaustion and heat stroke are things that we are seeing more and more and more of in Saudi Arabia. We see a lot of heat exhaustion. We even see it in the UK, where you get a bit of a headache, a bit of a dizziness. Maybe people that have been on a hot country, spent some time in the beach, or you've gone out, you feel a bit nauseated, you might actually vomit, you get muscle cramps and a high temperature. That's heat exhaustion. And it's often dealt with rehydration. But heat stroke is a medical emergency. And I need to emphasize this because the Saudi authorities are probably one of the world's experts in how to deal with heat stroke. And in fact, I can say this with certainty because the Olympics in 2012, they sought guidance from Saudi on how to manage heat stroke. They've taken guidance from them how to manage it in terms of, the marathon and so on and so forth. But heat stroke, hopefully none of you will get if you take precautions, but it's when your skin becomes red, hot and dry, you become excessively sleepy, confusion, you start talking what is essentially nonsense, and your colleagues will notice that, your companions will notice that, you may become aggressive and your temperature will rapidly rise. If you find somebody is subject to these sort of symptoms, please, please, please seek medical advice. This is an emergency. So confusion, aggression, really high temperature, or they're not aggressive, they're unreasonably sleepy, you just can't rouse them, their skin feels hot, they haven't drunk, please seek medical advice. This is the slide just to let you know, in Wednesday, 7th of June, look at the heat in temperature. In the nighttime, it was 33 degrees, at 9 o'clock it's 39 degrees, at 3 o'clock in the afternoon it's 47 degrees. I cannot emphasize to you how much the heat is a problem. People do not realize it's going to be that hot. I would always say avoid tawaf and sa'i in the midday heat. Many people are tempted to try and make their way into the haram on the 10th of Dhul Hijjah, which is the day after Arafah, where the world, for those people that are not performing Hajj, are celebrating Eid. But for the ones that are performing Hajj, we need to do a tawaf and sa'i. But please, please, please don't be tempted to go into Makkah in the midday heat. It is going to be extremely difficult, extremely congested and very uncomfortable, especially if you have not prepared for this. So this is what actually happens, and it's very common. Lots of heat, lots of heat, lots of heat. You've exerted yourself. You haven't realized how much walking you've had to do. For those of you that are tempted to walk between Arafah and Muzdalifah and Mina, Arafah can be 4 kilometers. Muzdalifah can be another 4 to 5 kilometers, and Mina, the Jamarat, is on the other end of Mina, and that can be another 4 to 5 kilometers. Having done that walk on a few occasions, you're talking walking 15 kilometers. Some people are then tempted to walk to the Haram, which is another 4 kilometers, and then do sa'i and then do tawaf and sa'i, add on another 3 plus 4. You're talking a 20-kilometer walk. I would really discourage you from doing that. I would say seek the guidance of your guide, seek the guidance of people around you who had experience, who will be able to tell you when you should and should not be doing this. But the heat, exertion, dehydration, not drinking enough, and fear will often lead to collapse and will lead to ending up for you going to hospital. It happens. What people do, and unfortunately it is a common problem, hopefully it will be less if people take heed, but it is to an extent self-induced. People are worried too much about poor sanitation. They're really scared about toilet facilities, and you do not need to be. I cannot emphasize enough. I honestly do not believe that the toilet facilities are that bad. I don't think you need to over panic about this. But what people do is they just do not drink enough water. So what they do is they hardly drink anything. They overexert themselves. They're excessively sweating. You can lose up about 1 liter every hour if you're walking in the heat. They don't respect that, and then they try and replace it with a 330 ml bill of mils of water. If you find somebody that is collapsing or really unwell, they need more than just a bit of water. Move them in the shade, loosen the clothing, give them fluids, avoid just a cup of tea, cool flannel to the skin, and seek medical advice. This slide is really just to emphasize that on a normal day, an average individual needs between 2 to 3 liters with supplements, sodium, potassium, all the other chemicals. In Hajj, it is not unusual for people to only try and drink half a liter of water because of fear. Please, 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 please do not do that. It is not worth it. It really isn't worth it. You need to be sensible about this. do not worry about things like toilet or sanitary. It really isn't that bad. Another thing is people collapsing. Every year I've seen people collapsing whilst waiting for the trains. Very common. Often tends to be young people, not the elderly, because the elderly, in my experience, tend to just sit down. But there seems to be this notion that if you're tired or fatigued or your muscles are aching, you can't sit down. If you need to do, just sit down. Gender does tend to be a mixture of both males and females. I've had males collapse and females collapse. It's definitely not just females. And unfortunately, most of the people that I've seen collapse, 50% of them are, from what I would say, they are professionals, but they just seem to think that they're going to be an exception to the rule. So I would really encourage anyone, if you feel that whilst you're waiting, you're feeling a bit lightheaded, you're feeling you really can't stand, just sit down. Just sit down. If the queues aren't moving anywhere, just sit down. There's no point standing for 3 hours in the same place. Hopefully it won't happen, but it does happen on occasions and people do end up collapsing. Again, just to repeat, heat, exhaustion, dehydration, fear will lead to collapse and lead to people going to hospital. Just to now give you back, you've now done Mina, you've done Arafah, you've done Muzdalifah, you're now making your way back to Mina, and you have to, in Mina, go to the Haram to perform Tawaf and Sa'i and then return. I'm just going to give you real life examples of, again, this is a gentleman, he was 45 years old. He'd only drunk half a litre in 48 hours. He'd only eaten 1 yogurt. He says, I don't need to eat and drink. I'm actually quite a fit individual. Toilets are disgusting. I'm fine, go away. He was severely dehydrated. I had to rush him. And he was, in fact, a doctor. That was his profession. But he thought he was going to be an exception to the rule. No, this can affect anybody. So please, I would actually say that you know you've rehydrated yourself enough when you have the feeling that you need to urinate. If you go 2 days without going to urinate, you're dehydrated. It's a simple philosophy. It's a simple rule. You only know if you're filled enough when you get the urge to go. So if you are not needing the toilet, you're probably underhydrated. Like I said, after you've returned from Arafah, you now in Mina, you need to do Tawaf. Tawaf itself, on the ground floor, we're extremely congested. If you're going to do Tawaf on the middle or top floor, 3 to 5 kilometers, 7 circuits. Sa'i itself is 2 kilometers. Getting to and fro from the Haram, add in another 2 kilometers. You could be standing for a long period of time. There again, you're talking anything between 7 to 10 kilometer walk. That's a lot of walking. People do not realize how much walking is involved. So please, please, please avoid the midday heat. Respect the heat. Try and perform this outside the hours, especially after Asr time and so on and so forth. I will mention about wheelchairs and people that are in wheelchairs. I always remind people, only push if you can push and what you can push. If this picture here is to get anything to go by, every year we see people who are pushing somebody in a wheelchair, and the wheelchair seems to be laden with 3 or 4 extra bags, which is a huge amount of weight. If you imagine an average person weighs anything between 60 to 100 kilos, added another couple of kilos with weight, you're pushing the best part of anything between 80 kilos to 100 kilos, maybe even more, for the best part of about 8 to 10 kilometers. That's a huge amount of pushing. And the person that's going to get unwell is not one being pushed, but it's the one doing the pushing. And I've seen many people pushing who end up collapsing and actually giving themselves severe backache, severe strains, leg cramps, so on and so forth. So my golden tip is, if you need to push somebody in a wheelchair, only do it if you can push, and only push what you can push. And if it's going to be a problem, then consider hiring one of the push chairs and one of the people that will push for you. A couple of things now just towards this is, please, foot and skincare. Feet are going to swell due to heat. If your feet are swelling due to heat, please raise the foot of your bed. And what I'd encourage you to do is to pick up your mattress and put a suitcase under the mattress so that the foot of your bed always remains elevated. Try and moisturize your skin, walk carefully in the haram, and remove excess moisture. If you get water or your sand and grit, just remove them and keep your feet dry. Blisters, very, very, very common. The reason blisters happen is because you've got something hard rubbing on your skin. So the best way to do that is to make sure your skin is free of sand and grit. So if you're walking and you feel sand and grit in your sandal, please stop, take off your sandal, brush it away, dry your feet, and then carry on. Grit and sand is truly the enemy. It's truly the enemy when it comes to blisters. If you do get a blister, there's lots of blister packs you can buy. Any one of them will probably do. Elevate the feet, take plenty of rest. If you do get a big blister, there's always a trade-off whether or not you should or should not burst the blister. I would say seek medical advice from someone to decide whether or not you need to burst the blister or not. Again, another big problem in ihram, especially amongst males or those people that are challenged with size and weight, especially men, because we're not wearing any undergarments, the rubbing of your thighs in a hot, dusty, disheveled, sweaty environment will cause those thighs to rub together and give you an intense, intense rash. You can consider using Vaseline. My golden tip is to buy something called Body Glide. It's water-based. It's like an anti-deodorant stick. You can buy a small one. You can buy a large one that's about 10 or 12 pounds. You can put it in your little pouch. It's what marathon runners use. Extremely, extremely useful, and I would consider buying that. Alternative, you can use Vaseline, but it tends to be very gooey and sticky. But please don't go anywhere without using some sort of barrier, some sort of moisturizing cream such as this. Remember that. I think I'm towards the end now. I'm going to just talk about mental health. Unfortunately, I have witnessed a number of incidents over the years. I've heard people swear at each other. I've heard people getting into, I saw physical fights occurring. I have heard people actually saying, I don't want to do Hajj, please return me back to the UK. I've had situations where people have stopped taking their medication, and therefore it's not them that's been bothered, it's everybody else in the camp that's been bothered because they can't sleep, because they're not sleeping, so on and so forth. But that's with psychiatry problems. But what I will say is that heat and fatigue, anticipate that's going to happen. Anticipate that your body has rights over you. It has a right to be watered, fed, and rested. Dehydration will cause you to think irrationally. You may have a systemic illness which has got worse. You're going to be unkempt at times. You're going to be tired. There'll be high emotions. And I also know that the new Hajj booking system has caused a huge amount of stress on people. Very easy for me to say anticipate, slow down, and pack lots of patience. It may sound like I'm just rolling it off the top of my tongue, but I really, 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 really will say that please slow down, rehydrate yourself, make lots of dua and sajda, and anticipate what is going on. I've already mentioned what the hospitals do when it comes to mental health, but this is not people with mental health issues. These are people who just have not factored in the fact how stressful this journey is likely to be, but prevention is better than cure. I give an example. Your body has the right to be watered, fed, and rested. That is your right. That is your body's right. So a couple of things I'm going to ask people just to consider is, what is the length and time of the journey that you're going to be doing? If your flight is leaving at 7 o'clock in the evening, for example, you're likely to then be on a night flight. You're likely then to have a connecting flight in the early hours of the morning. It is likely the night before you would have not got any sleep. And if you're not having a connecting flight and you're going straight into the haram to do your umrah, you may not have slept for 48 hours. If you haven't slept for 48 hours and you're in the state of ihram, you're going to become very irritable. Do you like the food? If you really don't like the food, pack the food with you. I often would make myself a sandwich and I will pack it in my hold luggage. So when I arrive and there's no food, I can take it out of my hold luggage and have it there, something that I would like. Do I actually have health needs? Do I need to factor them in? Do I have all my medication with me? Ask yourself, what's your personality like? Are you somebody that wants things done quickly? Because quick doesn't always work in Saudi Arabia. And what are you like if you're not in control? Many of us work in very high-powered jobs. Some of us have lots of responsibilities. But in Saudi Arabia, we can only go as the fastest, as the slowest person in the group. If you're a group of 50 people and you have somebody that's very, very slow for legitimate reasons, we can only go as fast as they're able to go. So if that individual has got mobility problems, or they're old, or they have a reason where they can only go so slow, then we have to respect that. So please, please, please bear that in mind. Golden tips, I will say, take plenty of rest, especially before a long journey. Have lots of patience, slow down, rehydrate yourself, make lots of dua, and just accept that very obvious thing. We can't make journeys sometimes go any faster than factors which are beyond our control. I'll end with this last slide. It's a prescription list. Please, I'd call it the essential P's. Always take a prescription list with you. I will say, if you've got medical problems, take the patient details with contact numbers with you. I would say always take some paracetamol with you. I would say plasters are essential, especially blister plasters and things like that. Petroleum jelly or Vaseline or Body Glide is what I take with me. Knowing that antibiotics, penicillin, or an alternative you're allergic, are no longer freely available in Saudi Arabia, then I would say consider taking some penicillin with you, or a course of antibiotics with you, because you may struggle to get that in Saudi Arabia. They are my 6 essential P's that I would encourage all of you to do. Last slide, this is lessons from history. I will say this, please don't worry about dehydration, just respect yourself and make sure you're looked after yourself. Menstrual issues, please, 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 ladies, try and address this issue. If you have any concerns, then either speak to a GP or try and address the issues sooner rather than later. Please don't stop taking your medication, and that goes for people not just with mental health issues, that goes for diabetics, people with heart failure, people with asthma, people with cancer, so on and so forth. Psychiatric issues is not a problem. If you have a psychiatric issue, no problem, still perform Hajj, but just bear in mind, make reasonable adjustments. Petroleum jelly, obviously, like I mentioned. Please don't burn yourself out. It's people get tempted to try and do lots and lots and lots of nafil tawaf around the haram many days before Hajj starts, and then by the time it comes for actual Hajj itself, they're absolutely burnt out. Their feet are sore, they've got blisters, they've got muscle aches, they've got backache, and they're burnt out before Hajj has even started. And last thing is, don't be afraid to ask. There are plenty of people out there to seek advice from, people asked to seek counsel from. Don't be afraid just to ask. If there is something that you think you really need to ask, there's no such thing as a stupid question. Just ask. Just ask, and someone will be able to guide you in the right direction. And you'll be amazed how many people are probably thinking exactly the same. I will stop there. I've tried to keep on time because I know we've only got 5 minutes. I apologize if I probably overrun. I'm not sure if I have opportunity for questions or if there's any questions. So I'm going to hand back over to Brother Rashid. So if I stop sharing now, I think that'll probably be the best thing. So Rashid, should I stop sharing now? Would that be the best thing? Or I can carry on sharing and you can ask me any questions.
Hi, Assalamu alaikum.
Alaikum.
Not sure if my camera's working, but anyway, I don't really see my face. Yeah, let's go straight into the questions, I think. We've had quite a few come through, which we've answered, very generic ones. Are you able to see the questions?
Yes, should I just go through them one by one? And that will probably be
do that.
I'll read them out. Alhamdulillah, my wife and I finally managed to book onto package today. We've got onto the quadruple occupancy package. Primarily, we're hoping to get into double, but my wife's really averse to air conditioning. I had a couple of people with air conditions. Do you have any advice how she can avoid or combat the effects of AC, how she can get around this in shared rooms or rooms? Right, very, 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 very common question. We have this issue comes up all the time. Not just in the rooms, we have this come up. Someone wants to have the AC on, someone wants to have the AC off, someone wants to have the AC on in the coaches, someone wants to have the AC off in the coaches, in the tents in Mina, you have cooling systems. What I would suggest is that you ask for, you just engage with the people that you're sharing a room with, and normally you can come to a compromise. The backs of the coaches tend to be extremely hot because that's where the engines are. So that's the problem. So people that sit in the back tend to get extremely hot and want the AC on. The people that sit in the front tend to get extremely cold. So try and sit yourself in the middle. But what I'll say is communication is the key. With that one, can you recommend an unscented sunscreen, please? I would say just go to a pharmacy and see one that is without perfume. Right, I take hydroxychloroquine for rheumatoid arthritis. Is this medication okay to take? And do I need a GP letter for this? The answer is yes, take your medication, and yes, get a GP letter. Please advise someone who has trouble walking long distances. Generally, what can they do if they're forced to work long distances, i.e. from Mina to Muzdalifah? Right, number one, hopefully, you will not be forced to walk from Mina into Muzdalifah. Please seek the counsel of your guide. And I'll go back to what I say before. We should always try and factor in, we can only go as far as the slowest person in the group. Do not worry. If you really can't feel you can do it, I would consider using the services of a wheelchair and get somebody, if they can, push you. If the person can't push you, then ask whether somebody, see if you can hire a guide to push you. But generally speaking, you should be able to take the counsel, take some guidance from your guide, and we're able to arrange something for you. Is it okay for a woman in early pregnancy to perform Hajj? If yes, do you have any suggestions for her to keep her health? Pregnancy, there's no reason why a woman in pregnancy cannot perform Hajj, period, full stop. Pregnancy is a normal part of the human cycle. Absolutely no problem in early pregnancy performing Hajj. But what I would say is take things easy. Don't overdo it. Take plenty of rest. Make sure you keep yourself hydrated. If you need to be, go back to the hotel room. I wouldn't encourage you to do a huge amount of excessive walking, but absolutely fine, in my humble opinion, for pregnant women to do Hajj. She's more likely to have an asthma attack in air-conditioned environments. Absolutely right. If you are more likely to have an asthma attack, please make sure that you, one, like I said, discuss it with the colleagues that you're with. But more importantly, take your asthma pumps with you, take your preventers with you, take your spacer devices with you, and if you need be, take your nebulizer machine with you. Take everything with you. Prevention is better than cure, and really have a dialogue with the people you're sharing a room with. If you're likely to have an asthma attack, like I mentioned, please take a course of steroids with you. You should be able to get this from your GP, but take them with you. You cannot get them easily in Saudi Arabia, and take a letter from your GP. My wife will be coming to the end of her first trimester. What would you recommend preparation, what it's like to be? Again, it comes back to the early issue. Pregnancy is not a problem with undertaking Hajj. I would say that please just take things easy. You don't need to do anything else apart from taking things easy. Going on, sorry, I'm trying to go through this quickly because I know there's quite a lot. What's the best way to deal with the crowds and heat combination? I sometimes fade due to large crowds in the heat. Right, number one, crowds are present, there's no doubt about it, but you will find, even within the crowds, putting away all the pictures that I've showed you, there will be ample opportunity for you to be able to just spread yourself. You shouldn't be like this next to anybody. That if that's going to be the case, then move away until the crowd dissipates away. Where you're likely to be crowded like this is going to be in the tawaf, on the ground floor in the haram. Avoid the ground floor in the haram. Where this is likely to be the case, maybe waiting for the train, just move yourself to one side. You'll tend to find that the crowds, although there are crowds in terms of numbers, they shouldn't encroach upon your personal space. Heat exhaustion there, like I said, drink. Consider, obviously, with the ladies, you have the opportunity to be able to cover your hair. Consider using an umbrella, considering using sun cream, and take plenty of rest on the time. If you feel that you are likely to faint in large crowds in the heat, what I would say is break up the journey into small, bite-sized chunks. Don't do it in one big. So if you need to walk for half an hour and take 10 minutes, 15 minutes sitting down, do exactly that, okay? Severe eczema sufferers, Crohn's or fungal skin infections, take your emollients with you. That's simple as that. Take your emollients with you. Recurrent skin infections. If you have an antibiotic, antifungal, take it with you. Can you use Vaseline in ihram? The answer to your question is Vaseline. I won't go into the fiqh questions of what you can and what you cannot do, but what's not permitted in ihram is to have perfume. I don't believe people normally with Vaseline themselves as perfume on their wedding night, because it's not a perfume as such. It's a barrier cream. So in my humble opinion, Vaseline is not a perfume, so you can use it, but you may wish to ask that from a mufti. Do you have a recommendation list of basic medical items you should take, which includes what you listed or talked about today? It would be paracetamol, cycle tablets if you're a lady, antibiotics if you can get a course of antibiotics, but I do not really think you need to start packing more than possibly a bit of Imodium, a bit of plasters. I don't think you really need to take a whole list of pharmacy stuff with you at all. Any recommendations for those that snore very loudly? I would say snoring is a problem. We do have this happening all the time, especially in mixed tents. The person that is the one that's delivering the snoring, if he can be open and honest and people and say that he's affected by this and come to an agreement with what he would like people to do, and I think it would be very politely if you would ask them to move position, or if you would ask them if they can possibly give people an opportunity to sleep before they start. But often these people do not mind being woken or disturbed so that they can change position, which normally helps. Other than that, I have no real advice. How we get penicillin without prescription here in the UK? Speak to your GP before you go. Like I said, the GPs may or may not be willing to do it. It's not an absolute must, but if you can get it, it'll be useful. But it still requires it still requires a prescription. I see a wait to send passport, embassy, visa. What does that mean? I really can't answer anything related to the visa inquiries. What I would say is please seek some counsel from the partner organizations that are working with the Saudi authorities over there. Would you recommend taking tablets to stop your menstrual cycle? In my humble opinion, I've seen the amount of stress this does cause, and I've seen a huge amount of anxiety. So you've asked me a straightforward question. My answer would be yes. How many rehydration sessions do you recommend per day? Rehydration sachets I wouldn't recommend per day because in the normal days, outside the days of Hajj, you should be eating and drinking normally. Remember, Hajj itself is 5 days. Of those 5 days, day 8, you will be in Mina. Day 9 will be in Arafah. You will have food. It's just really for 24, 36 hours. So in that period of time, yes, use rehydration salts, but the rest of the time you should be eating and drinking as normal. What do you know the medication to stop periods, which can be taken 3 times a day? It's called norethistérone. How effective is it? It's I would say in my humble opinion, it's very effective if you take it properly. That is exactly 8 hours apart. So it's called norethistérone. It's not Noraday, which is taken once a day. That tends not to be as effective. And you wear boxer shorts under ihram? The answer is no. Salam, I've been given the medroxyprogesterone tablet to lower my period. It says to take day 2 daily on the box. Never take this tablet. How do I time this, please? Medroxyprogesterone is an alternative to the norethistérone, which is prescribed 3 times a day. It's licensed for up to 21 days. I think it's splitting hairs. My personal preference is norethistérone, but medroxyprogesterone, if they're saying take it twice a day, do take it twice a day. But some GPs I know are, this is called Provera, are prescribing this. Can I wear a belt under the ihram? If you're using a belt to support your ihram, that's permissible, but please guide that question to somebody that will answer 5 questions. Is Voltaren gel advisable to use when ihram? Voltaren gel is an anti-inflammatory gel. If you need it because you're using it for medicinal purposes and you have aches and pains and medicines are perfectly permissible, then use it. It's not perfumed. So if you need to use something, then you need to use something for medical reasons. Please advise period delaying medication. I think I've answered that already. Does EpiPen need the fridge? No, EpiPen doesn't normally need the fridge, but one thing about EpiPen, if you need an EpiPen which is used because you have a severe allergic reaction, please make sure the companions you are traveling with know how to use the EpiPen, because if you need it, you're probably not going to know how to, you'll know how to use it, but it's your companion. So please give them guidance on how to use it. What about normal tablets? Normal tablets, only keep those in the fridge that you would keep in the fridge in the UK. So if you don't keep them in the fridge in the UK, you don't need to keep them in the fridge otherwise. Can we get a sport rucksack with water type attached to it? I'm sure you can. You can probably go to Sports Direct. Foot care for bunions. You can get lots of things for bunions if you wish to use them. Knee pads. In ihram, ihram is 2 items of clothing with the intention. I wouldn't wear knee pads generally, but if that's going to be worn in ihram, then please speak to a sheikh regarding that. If a woman's period starts, can she perform Hajj still? The answer to your question specifically is, can you perform Hajj? Yes. Can you perform all the arkan or the pillars of Hajj? There are certain things you need to be in a state which is free of menses, and therefore you would need to speak to a sheikh to get that advice. So the general answer is yes, you still perform Hajj, but there's certain variations that you'd have to deal with. So what I would say is please, please, please deal with the menstrual issues before you get yourself in that situation. Can we have this presentation paper saved so we read it again? I believe that Brother Rashid has said this will be available. I have no particular ownership of this. It comes free, anybody can read it. Can a GP issue antibiotics as a precaution? Also, I'm asthmatic. The answer is, can they? Yes, they can. Will they? That's a separate question. I'm also asthmatic. I would go and speak to them beforehand to explain to them what Hajj is and see what their take is. In my humble opinion, most GPs are very understanding and will accommodate. Please advise. I've given that advice already, so I'll move that one. Should one get medical insurance? What I will say regarding this is medical insurance is a fiqh type issue. I'm not going to get involved in fiqh type issues. However, if you have to repatriate somebody back from Saudi Arabia, for example, they've had a heart attack, a medical evac for someone with a heart attack needing a medical escort on ITU is somewhere in the region of about £25,000. I'll leave you to make your own decisions. Rosacea, please speak to your GP about this at all. They're probably better advised for rosacea than I am. Is there any shoe wear recommendations for one with foot wear problems? Yes, I would say that you should get an insole. There's insoles that you can wear. I'm trying to think of the name. I bought mine from eBay. I apologize, I really have forgotten the name, but I would get a good supporting insole. What some people do is to buy sandals that they like and then take insoles and glue them in to the actual sandal. That works really well. So it's like walking on a cushioned platform. So that's something you might wish to consider doing, especially with the medial arch support. As you know, anti-chafing body glide is water-based. It does not have any perfume in it. So my humble opinion is the answer is yes. Any recommended brands of sun cream during ihram? I don't use it myself, but I have used it in the past, but I don't have any specific recommendations. What is your opinion on liquid IV? I take it that is somebody that's after intravenous fluids. I don't believe people should be having intravenous fluids unless it's medically indicated. And I would say prevention is better than cure. What is the Menveo vaccination? Is it recommended? Menveo is the other name for the ACWY. I don't think you need that one. You should just stick with the vaccines that have been recommended. Can you use prescribed creams during Hajj? Pro topic there again, medical creams are perfectly permissible as long as they don't have perfume in them. Can you use kinetic tape? I'm not sure. I've never really come across people using kinetic tape. I knew you use the barrier cream. What type of sandals are permissible in ihram? You'll get lots of different opinions regarding this. It's probably better that you find a sheikh who you are comfortable with, take that opinion from, because there's different opinions to what constitutes the foot bones, which need to be uncovered during Hajj. Can you use pseudo cream for rashes? There again, I believe it's on perfume, so it should be okay. Can I use vapor rub for pains? Vapor rub, there again, vapor rub normally has menthol. It's a bit of an interesting one here because menthol, some people say is perfumed. So it does have a perfume element to it. There again, I would seek some advice from a sheikh and follow that advice. Can we use trainers? Well, there again, footwear is a fiqh issue, so please speak to the sheikh regarding this. But remember, you'll only be wearing footwear for ihram only for best 1.5 days when you perform your first umrah, and then from the 8th, 9th, and then the 10th of Dhul Hijjah, which is 48 hours. So I think it's probably better to avoid trainers. Is it okay to manipulate your period by taking pills earlier so you don't start in Hajj? Well, there again, this is a fiqh question. I can only talk about what medications to take. If you feel that you need to take a fiqh answer to this, please ask the sheikh. But like I mentioned, there's lots of issues regarding menstrual issues that really do upset and cause a huge amount of anxiety. Is there a chance my period can start early during the heat? Can I take Nirasan as soon as I see blood? I would say, like I've mentioned, many GPs advise norethisterain to be started 3 times a day. I'm a bit more of the opinion you should start it 4 or 5 days before your period starts. Utolvan, I'm not sure what Utolvan is, so I'll refrain from that. It's probably something your GP has given you, but if you gave me the proper name, I'll probably be able to answer that. How can someone deal with panic attacks? Panic attacks, unfortunately, do happen. I have a huge amount of sympathy that people will have panic attacks. What I would say is Most people will know the triggers for their panic attacks and try and avoid those triggers as best you can. And please, please, please get the support of your colleagues around you and people within your group. If you really think it's going to affect the group, then speak to your group leader or your tour group guide to see how they can facilitate you having less of these. Maybe they can facilitate you being placed in a mattress in Mina somewhere which is closer to the doors, or you're sitting in a place in the coach journeys or so on and so forth that they can help facilitate this. What do you recommend on taking insulin? How to pack and where do you store? I've already mentioned insulin. Insulin is used for diabetics, how to pack it, where to store it. Should pack it in the refrigeration where you've got it, as you normally would do, but for travel, please use Fryo, which is freely available, which is a transport medium, transport pack. You can buy it from Boots, Superdrug, so on and so forth. Liquid IV is like powder, you add it to water, rehydrate. Would you recommend, like I've mentioned before, any form of rehydration? I would say that if you're going to rehydrate yourself, something added to water is better than just water alone, but prevention is better than cure. So by all means, if you feel you need to use it, I think, Jazakallah khair, thank you very much for the lovely comment. Let's go do a fragrance-free pseudo cream thread and bro brand. Thank you, that's very useful. I didn't know that, alhamdulillah. What brand of cough sweets do you recommend without alcohol? Well, in Saudi Arabia, they have some really nice cough sweets. I tend to go to the one that the pharmacists recommend. They do taste nice, they're not full of sugar, and they do tend to work. How many days can you take a 3-day period stopping tablets for? I take it doing this. What will happen the moment you stop taking the tablets? Probably within 24 hours, your cycle will start. So hopefully that answers that. Proveria, I think, is licensed for 21 days. Northisterone is licensed for a bit longer. Can we take over-the-counter multivitamin tablets in Hajj? Well, they're not perfumed and they're food. Take it if you feel that's useful. Is it worth bringing a sleeping bag? Difficult one to say. If you feel that you need a sleeping bag in Muzdalifah, then by all means do so. But I would always encourage people, only pack what you can carry. If you can't carry it, then don't pack it. And bear in mind that every additional bit of weight that you are carrying from Arafah to Muzdalifah to Mina, you're going to have to carry. And I see people carrying what is essentially like suitcases, and I do worry what they're carrying them, because it really begins to bog them down, and it causes a huge amount of anxiety. So by all means, if you feel that you need a sleeping bag, then by all means consider getting one. Just because I can sleep without a sleeping bag, I don't make any assumption that everyone else can. That needs to be a personal choice. Right, what advice would you give to someone with severe arthritis in the knees to help them prepare for Hajj? Okay, number one, you should know your own exercise tolerance. If you feel this is going to be a problem, first of all, maximize your medication. Take any creams that you need to take any medication that you need to take, and do consider using all the available walking aids that you have. Use a walking stick with you at all times. Make sure you have good fitting footwear. And if you need to use a wheelchair, don't be at all embarrassed in using a wheelchair. Should we stop drinking tap water? I would not advise tap water in Saudi Arabia. Use bottled water, everyone else done. Northisterone is the generic name. That northisterone is a generic name. That's what you use for cycle. What energy tablets you suggest? Well, this is a funny question. People say, what energy tablets do I suggest? I don't normally take energy tablets, but when I have taken them, I must admit, I just buy the Lucozade or the glucose tablets from Poundland, which is about 51 of those little tablets, which give a really good sugar rush. But any other supplements, any tablets that you wish to take, you can take. Can I use a dosage box for my regular medication? Will this heat ruin the medication? No, if you use a dosage box and the medication don't need to be kept in the fridge, you can use a dosage box. And I think what would you recommend for breastfeeding mothers? What I'd recommend for breastfeeding mothers is by all means breastfeed your children. Alhamdulillah, excellent. But make sure that you consider taking shields, and consider using something like the one that I recommend is something called Camilla-San, which is made of beeswax. It's non-perfumed, but some sort of barrier cream to stop chafing. Can you take a trolley bag? Well, you can take a trolley bag. I presume you're talking about going to Mina, Arafah, Muzdalifah. The answer is you can take what you can carry. I don't have a big beef about people taking what they wish to take, but sometimes people do overtly pack, and I do worry what they carry. So you need to make a decision yourself, but I would say pack sensibly. Do we need sleeping pads? I take it sleeping pads or sleeping bags. Sleeping pads, I have seen people use sleeping pads. if you feel that you need a sleeping pad because it will be easier for you and you don't feel comfortable sleeping on the hard concrete, by all means, if you can carry it, take it. That's fair enough. I've seen people go to is it like Decathlon, I think is one of them, or one of these sports companies, and they have these self-inflating pads that wrap up really small, but when you put the air in, they inflate really quickly. They're useful. So yes, you don't need sleeping pads. Should you take them? If you feel that you need them, then by all means take them. Should we avoid drinking ice cold water? Well, if you ask my dad would say, why do I ever drink ice cold water? I do like ice cold water. Should we avoid it if you have a sore throat? I'm going to listen to what my mum used to say to me, would say avoid cold water. It's probably not good. Yes, but I know that people are realistic and they will, ice cold water when you have a sore throat sometimes makes you feel good, but I would say stick with warm drinks if you can. Should we draft our will before we go Hajj? There again, that's a fiqh issue. I won't answer that question. Is there any medication for me to take to stop discharge? Discharge can mean lots of different things. Sister, I take it this question is from a sister. What I would say is please speak to your GP to try and address the issue of discharge. All the things that I've mentioned have been respect to menstrual bleeding. I think that is the last question. I think I've gone way over time, Rashid. So I'm going to hand back over to you. I've tried to go through the answers really quickly so we've got everyone's questions.
I think that was really, really good. We've still got loads of questions coming through. But if I may, Dr. Imran, we've got a couple of guys online who've put their hands up. If we can get them to ask the question in person, is that okay?
That's fine, absolutely no fine at all. But please.
We'll give it about 5 minutes and then we'll close up. Is that all right?
Perfect,
okay.
by all means.
So I'll call on Ido Suryo. If you can unmute yourself, Ido, and then Muti.
Sorry, I pressed it on purpose. Sorry, Dr. Imran.
Lower your hands if you not.
Yeah. Yeah, I did. Thank you.
Medical questions only, please. Okay, Muti. Okay, perhaps we'll try one more. Rehana, do you want to come in, ask a question? Okay, I think we can wrap this one up. Thank you everyone for joining us. Just before I end the session, there's a quick poll I'm going to launch. If you can quickly answer it whilst I go through a couple of other things as well. For those of you who are from Scotland, we've got a Hajj seminar coming up on the 3rd of June. Details will be sent over and will be on our social media as well. So do come join us there. Be kept up to date with all Hajj 2023 developments. Visit our website at cbhuk.org/Hajj 2023. There's links to our WhatsApp support groups, articles. And talking about articles, we've got a series of about 5 or 6 documents that Dr. Imran has done, which we'll start sharing with you all as well. A link and then build you up to going for Hajj as well. These are in-depth articles that he's written. And I just want to say thank you to Dr. Imran for his time. I think I could speak for everybody here that we could probably go on for another hour, but I'm conscious that you've had a long day at the hospital as well, and we do need to get ready for Maghrib. So wishing you all a Hajj Mabrur and accepted Hajj. Do pray for us. We're not completely there yet with our visa, but Team CBH inshallah will be out there on the ground as well to support you. So once that's done, we'll email you all our details and contacts, and inshallah we'll see you in Mecca, and remember us in your du'as. Jazakallah khair. Just wait a minute or so whilst they complete the poll, and then we'll call it a night inshallah. Jazakallah khair.
Jazakallah khair to everybody for attending and for listening. I hope it's been useful and beneficial. Remember, us and all the brothers and sisters have lots of patience, and inshallah, I hope to see many of you in Hajj, inshallah. Don't give up any hope if you're having struggles. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.